So what exactly is Ozempic?
It's a miracle. It's too good to be true.
Ozempic, it is literally the hottest drug in the country right now. But what happens when you stop taking it?
A lot of empty carbs. I gained some weight that I lost back.
Everything that you took it to hide comes back.
Ozempic.
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 Today's podcast is brought to you by Ozempic. But not in the way you think. They're not sponsoring me. Instead, they have inspired me because the medication that is intended for those with type 2 diabetes is now being prescribed widely for anybody who wants to lose weight, which is interesting because when you go to the website, the Ozempic website, it very clearly states that it is not a medication for weight loss. It says you may lose weight, but the goal is actually to lower your blood sugar. It's not to lose weight, but it's being prescribed specifically within the fertility space by physicians who are encouraging their patients to lose weight to improve fertility outcomes, which is particularly interesting because there was a study that came out March 14th, 2022 from the University of Virginia Health System, where they actually found that weight loss doesn't help pregnancy chances. So a randomized study of 379 women with obesity and unexplained infertility found that intensive lifestyle changes that shed pounds led to no better chances of pregnancy and healthy births than simply increasing physical activity without weight loss. So, reading and understanding that study, it should be that physicians are encouraging patients to increase physical activity, not lose weight, which ultimately would be a healthier take generally. I'm coming to this topic with an interesting perspective. I'm coming to this topic having been someone who had an eating disorder, somebody who then opted to focus on strength training and becoming a stronger version as opposed to a skinnier version of myself, both in a mental and physical capacity. And I'm coming to you as someone who focuses on fertility and who has a pretty in-depth understanding of why Ozempic babies occurred at the rate in which they did. I had someone, when I put out on my social, I said that I wanted all of your questions with regards to Ozempic, weight loss, fertility, etc., and so forth. And one of you wrote to me that you went on Ozempic because your BMI was 32, that you became pregnant within the month. It didn't take, but you were curious as to why you were so fertile. So that was a very interesting series within one question. The fact that your BMI was high and that you then were prescribed Ozempic is interesting, simply because Ozempic is actually not prescribed, or at least it's not supposed to be prescribed again, as a weight loss medication. It's supposed to be prescribed to lower your blood sugar. So the way that it works, Ozempic, it's a GLP-1 receptor agonist, which essentially is a man-made version of a GLP peptide called semaglutide, and it selectively binds to and activates the GLP-1 receptor, which is a natural hormone that keeps your blood sugar balanced. This is really important because it helps us understand that it's actually more about blood sugar regulation than it is about weight loss. What I found particularly astounding when I was doing my research on Ozempic is that on the website, again, it clearly states that it's supposed to be done in combination with lifestyle and dietary changes because it is a type 2 diabetes medication. And Novo Nordisk, they have not conducted any studies to evaluate the effect on weight after the discontinuation of Ozempic. It's taken once weekly as an injectable. It's given as a pen format. It's injected subcutaneously, so like underneath your skin, and not into like a muscle, for example, or intravenously. Side effects include, but are not limited to, nausea, which is 80% of all people who took medication found that they were nauseous at all times, diarrhea, abdominal pain, and vomiting in 30% of all people on the medication. So 30% of everybody on Ozempic, which, just so that we're clear, is a lifetime medication, as in it's given to you to take for life. I know there's a lot of conversation around like, oh, you'll start taking it to kickstart weight loss. But the manufacturers of the medication are intending for you to take it for life. Anyway, so 30% of all of these people who are on this medication to take for the rest of their life, specifically, are now vomiting. And the last minor side effect is constipation. Other side effects include thyroid tumors, thyroid cancer, and very specifically, it says you shouldn't take Ozempic within 2 months of trying to become pregnant because it's not known if it can harm your unborn fetus. It can also cause inflammation of your pancreas, low levels of blood sugar, and kidney failure. It's suggested that if you experience nausea, you should eat a bland, low-fat diet, which is interesting because healthy fats help regulate blood sugar. But it's recommended that you eat a low-fat diet with examples given were crackers, toast, rice. They suggest avoiding lying down after you eat. They also recommend that you go outside for fresh air and potentially eat more slowly. So a lot of those recommendations that are given to help manage the nausea that you could have from taking Ozempic would actually just be beneficial if you just did those, like going outside, getting fresh air, moving after you eat, and ensuring that you are eating slowly as opposed to quickly. All of those help regulate your blood sugar, and none of them involve any of the potential risks that were listed above. It's only recommended that you go off Ozempic if you drastically change your diet and you increase your exercise habits. It says Ozempic may help you lose some weight, and the example that was given of what you could potentially lose is about 14 pounds. But it is not for, and they emphasize this several times, weight loss. The way that Ozempic potentially could be improving your fertility is exactly the same way that diet and exercise could without Ozempic, in that it improves the likelihood of spontaneous ovulation when you regulate blood sugar and when you lower inflammation. A natural alternative, and ultimately any alternative that I give you or that I recommend, please discuss with your physician. Supplements, even food recommendations that I give on this podcast are merely my opinion, and because I am not your practitioner, I cannot give you specifically. Like I've said in previous podcasts, you know you're becoming a big deal when you have to give little recommendations so that nobody sues you. So here we are. Once again, big deal. Here we are. So one of the supplements that I've been using personally to ensure that my blood sugar is lowered is inositol. And the way that that works is it stimulates glucose uptake in your skeletal muscles, which allows for the decrease of blood sugar. For PCOS patients specifically, inositol produces the remission of symptoms as well as the reduction of male hormone secretion, androgens, a regulation of cholesterol levels, more efficient fat breakdown, which then leads to a significant reduction of body mass and actually lowers your appetite, which is important because that is the same thing that Ozempic does. In the brain, inositol has been shown to produce an increase of serotonin receptor sensitivity, which produces an increase in GABA. And some of the effects observed in the brain produced a relief from symptoms of anxiety and obsessive compulsive disorder. It's also been studied and proven to benefit panic disorders. And in cancer research, it's gained an interest as an antioxidant, an anti-inflammatory, and to help modulate the immune system. What are the downsides of inositol, you wonder? Well, initially, it can cause loose stools if you take more than 2 grams at a time. So you work up to it. I've always tried to recommend to patients, and in my own case, I'm like a cowboy, and I thought, hey, my stomach can take anything. And I went ahead and I took 2 grams in my coffee. I had read about all of the benefits of inositol. For me, I was mostly taking it for blood sugar regulation and to reduce anxiety. And I thought, hey, why not? I'll add this to my coffee. And I drank it, got into the car, almost shot myself on the QEW, and then became very firm about patients taking it in a lowered dose initially and then working up to that 2-gram recommendation. If you really truly have an iron stomach, fine. Go ahead, test it out 2 grams at a time, but make sure you're not getting into a closed vehicle because that could be problematic for you and your car. Anyway, back to what we were discussing before I got a little too personal with you. How inositol can benefit blood sugar, which once again, I really must emphasize is what Ozempic is doing to increase weight loss. It also, just as an aside, it's increasing weight loss because it's ensuring that you are not eating, you're not hungry. And so one of the side effects of Ozempic, along with losing fat, is losing muscle. Before we get into that, now we're like layering upon layering upon layering. I think it's really important that everybody understands the metabolism. So one of the facts that I used to spit out as a baby personal trainer to clients that were coming into the gym was that a pound of muscle would burn significantly more calories at rest than a pound of fat. And that you'll often see on like TikTok and on Instagram, influencers saying, this is me at 140 pounds of, muscle, whereas this is me at 120 pounds of fat, and they'll look leaner at 140 pounds than 120 pounds where they have more body fat. There's several problems with that, but one of the main problems is that it's not being totally honest when it comes to the understanding of metabolism. We all have a base metabolic rate, which is essentially the amount of calories that we are burning at rest. And most of those calories are actually being burned by your large organs. So heart, kidneys, liver, brain, not necessarily by muscles and fat. And so this argument that if you have more muscles, you're burning more even at rest is actually a pretty poor argument and can lead to a lot of confusion and frustration in clients who are trying to put on muscle to be able to eat more. 30% of your calories per day are being allocated to physical movement. If you are moving more than that, like you have a very active job, then it might be more than that. But on average, about 30% of those calories are being burned with day-to-day activity. 60% is the base metabolic rate, and then your last 10% is roughly spent on like digestive process. All of these little tips and tricks that in the 90s were headlines of magazines, like add more ice to your water to burn an extra 7 calories a day, or take the stairs instead of the elevator to burn an extra 30 calories. Like, yay, I'll be able to eat, 1/4 of a cracker. It's perpetuating this like toxic diet culture of like calories in versus calories out. And so where we're now falling when we start discussing this in terms of like Ozempic is understanding that the way in which it's working is, yes, it is improving blood sugar, but it's also decreasing your appetite so that your organs are burning more calories, the ones that you can actually manage to eat if you're not so nauseous. And the issue, the biggest issue that I take with this is that we, as a society, hate ourselves enough to understand that 80% of the people taking this medication will feel so nauseous throughout the day that they can't even live their life as normal. And they would rather be nauseous and miserable than perceived as overweight. What does that say about us? What does that say about us as a society? Now, I'm not gonna argue that being overweight is a healthy choice, but I am gonna argue who's determining what overweight is. We have all of these confusing metrics. We've got BMI, which is so easy to disprove. In this poor woman's comment where she's talking about her BMI being 32. Okay, I'm 5'5" roughly, and I'm about 140 pounds. And if you were to look up my BMI, it would be on the verge of being overweight. Do I look overweight? No. Do my clothing sizes say I'm overweight? No. Can I squat 185 pounds for 10 reps for 4 sets? Yeah. Is my blood sugar fantastic? Are my CBC levels, my complete blood count, does it look like that of like a healthy 25-year-old with optimal ranges being achieved? Yeah, which is pretty impressive given that I have fucking lupus. Why is that being achieved? Because I have leaned into exercise and focusing on foods that are ensuring that my blood sugar is balanced, as opposed to focusing on calories in, calories out. Another person who wrote to me, somebody who is very actually near and dear to my heart, wrote, I've been on Ozempic for 1 year and I've lost 133 pounds, but I feel sick. So you've lost 133 pounds. That is an amazing accomplishment. But the only way that this person can now get off of Ozempic is if she has also modified her lifestyle. When doctors are prescribing Ozempic, there is no catalyst for weight loss aside from actually taking the medication. There is no recommendation as to what specifically you should be eating. They say, like high protein. But then when you go on the Ozempic website, the recommendations are not high protein. It's rice and crackers to get through the feelings of nausea that you might have. So exercise, no recommendation is given as to what that entails. Cardio, for how long? Weights, how much? Who's helping you with said weights? What recommendations are there for weight training, resistance training, etc., and so forth, which is extremely important because as you'll see when you're driving down the highway and you see the Ozempic signs saying, I just had to ask, or it's like, I just asked, or just ask, implying that if you just ask your GP for Ozempic, you'll likely get it. But the people who are being represented in these billboards are men and women who are over 60, where muscle mass is extremely important to improving your overall health as you get older. Sarcopenia, which is muscle loss, is one of the leading causes for falls, which is one of the leading causes for death of the elderly. Do you think, common sense here, do you think that your chances of becoming better in terms of muscle mass and strength is going to improve as you become older, or is it going to become less so? As your testosterone starts to drop and gaining muscle becomes a harder endeavor, does it make sense to now start taking a medication that is going to increase your loss of muscle mass? No, that makes no sense whatsoever. So the same would then, you could apply to women who are hoping to become pregnant. Does it make sense that as you are about to enter a phase of life where lean mass is going to be lost because you are not going to be able to lift as much weight, and where studies have been done where pregnant women who were found to improve their VO2 max during pregnancy, that was maintained after they gave birth. So their improved VO2 max that they were able to accomplish during pregnancy was maintained after birth, which, if you're looking at human evolution, suggests that we as humans aren't intended to just sit around on bed rest. It was also found that women who maintained lean mass during pregnancy and who improved their VO2 max actually gave birth to babies that had higher amounts of lean mass at birth. That is a benefit that they are going to have for the rest of their life. So we as a society are no longer looking to improve our health. We're now hoping to just get by. From a body image standpoint, now we're like going back to this concept of like calories in, calories out. If you are a mother who has now taken Ozempic in order to lose weight because your doctor has told you that that will help in the chances of you becoming pregnant, you then have lost muscle mass. Yes, your levels of inflammation are lower. Would you feel more comfortable becoming pregnant having taken something like inositol, where there is improved fertility, where it is known to improve egg quality, and where it is known to improve mental health as well as balancing your sugars? Or would you rather have taken a medication where it is recommended that you do not take it within 2 months of trying to conceive, because the studies have not conclusively found it to be safe? A lot of patients who have been given this recommendation by their doctor actually don't know that. And so their doctor says, I think you should go on Ozempic. They then become pregnant. Like, at that point, no one is responsible for that baby except for you. And if something should turn out to be wrong with your child, which is a probability given the warning on the Ozempic website, no one is going to take responsibility for that. It's just something you're going to have to live with. And that actually sickens me, because once again, the people who are paying for, corporate America and big pharma are the people who are taking it in good faith, not the people who are padding their pockets. And I just can't have that be. I just can't. So here we are, breaking down the facts and giving you alternatives. So let's discuss, because often Ozempic is recommended for patients who have PCOS. The argument is that by improving glucose levels, you thereby improve, A1C levels, which is not only helpful for your overall insulin sensitivity, but also lowered inflammation. Facts. Straight up facts. Okay, no problem. But also comes with a risk of sarcopenia, muscle loss, nausea, thyroid cancer, constipation, diarrhea, and pancreatitis, and ultimately kidney failure. KK. What if there was a supplement that could do the same thing in terms of benefiting, systemic inflammation and improving blood sugar levels. But where the only side effect was potentially loose stools if you decided like a lunatic to take it all at once. I just gave it away. That's right. It's inositol. Okay. Best of all, inositol is pretty cheap. You can get it almost anywhere. It doesn't have to be prescribed by a doctor. And it helps PCOS. You can take it if you don't have PCOS as well. The only patients who should potentially be wary of inositol is if you have hypoglycemia or low blood sugar, in which case don't take inositol without direction from your physician and without medical monitoring. I should say that you should do that just generally, just to, save my own ass, but I'm going to say it specifically for hypoglycemia and for everybody else to use, common sense when going through what I'm about to discuss. Decide whether or not this would apply and whether or not you could potentially benefit. But specifically, the way that it benefits PCOS patients is by improving insulin resistance. So with PCOS, insulin resistance plays a key role in the clinical development of PCOS. And the presence of hyperinsulinemia can induce an excess in androgen production by stimulating the ovaries to produce androgens and by reducing the sex hormone binding globulin serum levels. One of the mechanisms of insulin deficiency is thought to be related to a deficiency in inositol in the, oh my God, I hope I can say this correctly, inositol phosphoglycans. And the administration of inositol allows it to act as a direct messenger of insulin signaling and improves glucose tissue uptake. And the mechanism is then extrapolated to its function in diabetes treatment, metabolic syndrome, and in weight loss. It helps curb cravings. It enhances egg quality. It enhances egg quality. Reduces cholesterol. It improves insulin levels. It lowers gestational diabetes risk. And similar to that of Ozempic, it reduces inflammation. It's very important to note that all of these things will also be improved and your life will be greatly enhanced if you also focus on a diet to regulate your blood sugar and in getting daily exercise. As we discussed at the beginning of the podcast, it wasn't weight loss that improved fertility of these 300 some odd participants of the study. It was exercise. Now, it's really important to understand that there are a number of foods that you can eat to specifically reduce your blood sugar or to improve the balance of blood sugar. But I want you to understand that this has to be part of a larger lifestyle overhaul that is not focused and fixated on calorie counting and counting your macros and overall obsessive eating, because that will not benefit you, because then that is leading to high stress and all sorts of anxiety and depressive conditions, which not even inositol are going to help pull you out of. As I mentioned at the beginning of the podcast, as someone who had an eating disorder, I think it's really important that we as a society are not taking steps backwards when it felt as though, companies, for example, like NYX, who were helping pioneer this body positivity movement where we started to see models, not only in NYX campaigns, but also like Lululemon and Nike, who weren't this tiny, skinny, mini no curve, unrealistic expectation where women felt that they didn't know how they were going to look in these clothes because they didn't look like these models. And so it led to a permanent sense of dissatisfaction because every time you would order any of the samples that you were seeing, online and catalogs, etc. and so forth, you would then get them in the mail, try them on, and you wouldn't look like the model. But who the fuck cares? How do you feel in the clothes? Our self-worth needs to be so much more than how much we weigh, how much space we take up, and what other people think about us. I was going through the Lululemon website the other day, trying to find an outfit for a photo shoot that I was doing. And I was kind of disturbed to see that a lot of the quote unquote plus size models were no longer on the site. Why is that? All of a sudden, Ozempic has made it okay for people to become skinny because of health reasons. Like, did you not hear all of the various side effects that you could have? Is that healthy? Doesn't sound particularly healthy to me. I mean, nausea aside, I would really love to avoid getting thyroid cancer. Just as a quick little hypochondria note. But I specifically take issue as a mother of now a 13 and a 12-year-old, both of whom are girls, and both of whom are very sensitive to what the media is portraying as an acceptable body. The idea that it is okay for us, not only as women, because men are taking this as a recommendation for improved health as well, but the idea that being skinny, because it's known that you lose muscle mass along with fat, the idea that it is okay to be skinny now because of Ozempic brings up a lot for me. Was body positivity focused on becoming more than your body? Or was it because people didn't want to necessarily put in the work that was required to lose weight, and they never actually felt positive about their body in the first place, and rather it was all about what would be required to get there? The gym is a very intimidating place. Not understanding how to eat is very confusing. But if that was it all along, and that it actually had nothing to do with how we felt about ourselves, and that we finally felt like we were worth more than our body, and rather it was just a matter of not knowing how to get there, how to get skinny, really grosses me out. And is something that we need to be really honest about, not only with ourselves, but now with our children. Imagine that every single young woman that you know, and now every single 60-year-old woman that you know, and every single perimenopausal woman that you know, imagine that we took all of the energy that is being focused on losing weight and we put it towards something worthwhile. Imagine what we would be accomplishing right now. Imagine that your doctor, your fertility doctor, spoke to you about, different exercise techniques that would be more appropriate for you and your body to help you become pregnant, instead of this ridiculous fat-phobic bullshit around weight loss, which, as I once again stated at the beginning of this interview, has nothing to do with fertility. And that any of the Ozempic babies phenomenon is purely from not weight loss, but potentially the ovulation that occurred due to patients having a regulated blood sugar and lowered inflammation. Now, with all of the risks associated with a drug that we don't truly understand. Just food for thought. Speaking of which, let's talk about foods that regulate your blood sugar. So, before I got into this rant, I just want everyone to focus on eating a fairly well-balanced diet. There's some templates, I like to say, for diet advice. Mediterranean diet is very helpful. I focus on a paleo diet because I have not found grains to be overly beneficial, and I'm wary of the herbicides that are sprayed on them. Even the organic grains have been found to have these same endocrine disrupting pesticide traces, and so in order for me to avoid that, I have just avoided grains for the last 12 years roughly. But some people, they don't necessarily have that, and so like small portions of rice and oats are helpful for them. But I would like for you to take that into consideration, that it's less actually about like hyper focus on foods that are going to, be low cal, and more focus on foods that are going to be truly beneficial. So, for example, foods that are known to regulate your blood sugar, broccoli and Brussels sprouts are number one. So the sulforain that's actually present in the broccoli and Brussels sprouts, it gives that like sulfury smell to them, actually helps reduce blood sugar and enhances insulin sensitivity. Protein, that's a big one. You guys all are so curious about how much you should be having. I've spoken at length about it with both Bianca on an earlier podcast, as well as Lily Nichols on one of our earliest podcasts on how to eat for fertility. And the recommendation is roughly that you should have 1 gram of protein per pound of body weight. So for me, that would be about 140 grams of protein a day, which when you say it that way, I used to get really stressed out when people used to give me specific numbers. Because it sort of tied into that obsessive compulsive nature of somebody with an eating disorder and becoming kind of like a human calculator for calories in and calories out. But when you're instead focusing on thinking about your daily macros as like a pie chart and just trying to get, a specific number of grams of protein to benefit you, especially if you have gone on Ozempic and we're trying to rebuild your muscle, you want to aim for about 1 gram of protein per pound of body weight. Good examples of that can include, but are not limited to, fish, eggs, organic meats, and all of these help slow your digestion, prevent blood sugar spikes, increase your feelings of fullness, and therefore prevent overeating, all of which does not involve nausea and or vomiting. Pumpkin, which is packed with fiber and antioxidants and is actually known as a traditional diabetes remedy in China, Iran, and also Mexico. But it's high in carbs, polysaccharides specifically, but they've been studied for their blood sugar regulation capacity. Very interesting. Pumpkin seeds, which are packed with healthy fats and proteins, were found in a 2018 study where participants ate approximately 65 grams of pumpkin seeds during their meal, and it was found that it reduced their post-meal blood sugar by 35% compared to a controlled group. Tree nuts, so like almonds, for example, reduce fasting blood sugar levels when you're including them as part of a snack or a meal. Flaxseed, which is high in fiber and healthy fats, helps reduce blood sugar levels. And in an 8-week study of 57, small study, but still significant, 57 people with type 2 diabetes, those who consumed 30 grams of flaxseed each day experienced a significant drop in their HbA1c, which, as we've discussed earlier, is a marker of long-term blood sugar regulation. And similar studies noted that the same occurred with the consumption of about 30 grams of chia seeds once they were ground up. Berries enhance sensitivity of insulin and also improve glucose clearance from your blood. Fermented foods, specifically yogurt, because probably, my guess, you have not only the fermentation, which helps with gut health, but also the protein that's being found in the yogurt. Eggs, apples are also known to help balance blood sugar. eaten in its full form, because then that way you have the insoluble as well as the soluble fiber. So all of these foods that I just listed, you'll note the main focus of them is they're high in fiber and they're high in fat and protein. So when we're looking at what kind of a diet would be most beneficial, one that is high in protein, one that is high in healthy fats, and one that is high in fiber. And I know that that can be a really stressful concept when you're looking at like, okay, well, like I need a book on that. And you're gonna laugh when I recommend this, but I highly recommend that you check out Lily Nichols' first book, where it's Real Food for Gestational Diabetes. And she lays out not only the ultimate foods to help balance sugar, but she also gives like meal ideas where it's easy to digest as a consumer, not only from the standpoint of eating said food, but also in understanding the information and incorporating it as part of your day-to-day life. I hope that you have enjoyed this episode. I know that I have dithered here, there, and everywhere, and I didn't answer everybody's questions, of which there were too many, but I wanted to really delve into this understanding because, like, for example, weight stigma, fat phobia in the medical field, how it's a barrier to treatment, you know, concerns around Ozempic and trying to conceive, like, how can I lose weight? My doctor says I need to in order to do IVF. Like, it's just truly, when I'm getting all of these DMs, like, it goes on and on. And most of it is essentially like a sandwich of trying to pretend that this is all about health. In the middle is about weight loss. And then at the end, it's once again a health sandwich. So it's weight loss that we're trying to ultimately achieve without the understanding of what is actually healthy. And we need to figure that out. Because if your focus is on feeling well, if it is on reducing inflammation, and if it is about improving your energy levels and ultimately your fertility, then Ozempic's not for you. And lifestyle is. I mean, a lot of people were also writing about, you know, significant others that were on Ozempic or parents that were on Ozempic. And I mean, it's important to recognize that something that you can tell them after listening to this podcast, because now you have the understanding that this is about more than just fertility, is that sarcopenia, there's no medication to cure sarcopenia. Once you've lost that muscle, it's gone. And the only way to gain it back is through, once again, resistance training. So save yourself the time, energy, and effort. Don't lose the muscle in the first place, and instead focus on improving your overall, like, composition, where strength is the focus, not fat loss. Because by focusing on strength, you will lose fat. You will become less inflamed. You will become more balanced in terms of your blood sugar. I can't speak to like mental balance, although exercise is known to improve that as well. But ultimately, exercise and eating to support exercise is what will help you in the long run, not Ozempic. Thank you so much for listening this week. Every time that you listen, you share, you rate, you review, it helps boost our show, which not only gives me the motivation to carry forth, but also helps attract new guests with new information. So thank you so much. Please don't forget, again, rate, review, subscribe to our YouTube channel, and we'll talk to you soon on the next episode.